Oral cancer is one of the most misunderstood forms of cancer. People always think that if they don't use tobacco products, they are not going to get oral cancer. However, you may be surprised that this disease affects a wide range of people. It becomes critical to understand facts and fiction about oral cancer so that we can prevent oral cancer in general population. In this video, I am going to tell you about all the facts and myths related to oral cancer so that you can diagnose yourself early and prevent the disease to progress in advanced stages. So stay tuned. Myth number 1, finding oral cancer in our mouth and neck is very easy. Now the fact is, finding the cancer of the lips, tongue or cheek becomes easy because we can notice from our eyes. If the cancer is spread beneath the tongue, that is called floor of the mouth, back of the throat and lymph nodes. Certain lymph nodes are there in our neck. So it can go unnoticed for a longer period of time. And because of this unnoticed areas, globally there are high rates of mortality and morbidity. Mortality means cause of death and morbidity means cause of disease and discomfort to the patients. It's hard for you to detect these early signs and symptoms. For your dentist or a specialist, they can help you with diagnosing if there is a presence of this kind of disease. That's why we always recommend to regular visit your dentist so that they can check and screen your mouth and the throat, as well as if their early signs are present which you can notice. There is hoarseness of voice, there is changes of voice, if there is a ulcer which is present in your mouth which has not healed in 3 weeks of time or more than that, if you notice any bumps or swelling in your mouth which has not regressed, if you have issues while swallowing your food and there is a bleeding where you can't find the cause of the bleeding, then these are the signs you should not ignore and consult your dentist or a specialist. Myth number 2 is only smokers can get oral cancer. Fact is, it's true that the chances of oral cancer are very high in cases of smoking. It is not the only cause for oral cancer. Tobacco use is thought to be one of the primary reasons or risk factors for getting oral cancer, but who haven't smoked any point of time can get oral cancer. There are high chances that people can get oral cancer from human papilloma virus, that is called HPV infection. Myth number 3 is mouth and throat cancers are rare. Fact is, according to World Cancer Research Fund International, lip and throat cancer or oral cavity cancer are becoming one of the most common cancers worldwide. Myth number 4 is only older adults are at high risk of getting oral cancer. But the fact is, unfortunately, it occurs over and above 40 years of age, but getting oral cancer at early age is not impossible because there is a high link between human papilloma virus and getting oral cancer. Nowadays, because of the relation of human papilloma virus and oral cancer, more younger adults are getting diagnosed with oral cancer than compared in the past. Myth number 5, if it doesn't hurt, then I don't have to worry about oral cancer. But the fact is, although oral cancer is asymptomatic, which doesn't cause any discomfort or pain in initial stages as the disease has not spread so much far to reach the nerves. That's why oral cancer doesn't cause any discomfort to the person. The most common symptom of oral cancer nowadays is a precancerous lesion or condition. What is this precancerous lesion? These are the lesions which occur and will lead to conversion of tissue in cancer. These are white patches or red patches present in your mouth, anywhere in the mouth, either in the tongue, on the cheeks, on the lip. If it is there and if it is not hurting, better to get checked with a dentist or a specialist so that they should rule out whether this is going to convert in oral cancer in future. The myth number 6 is oral cancer screening or checkup is only required for high risk cases. Although the fact is, it is mandatory for the high risk cases to get regular screening or checkup done by a dentist or a specialist, but because of association of many viruses and there is evidence that this disease can transfer from their genetics. So that's why regular screening is required if there are certain white patches patches or red patches in your mouth. Early screening will help to prevent the progression of the disease, as well as the chances of getting disease free will be very high in cases if you detect the disease in early stages. Oral cancer cannot be avoided in spite of avoiding the risk factors. Mouth cancer prevention is all about avoiding the risk factors. You cannot rule out the chances of mouth cancer, but can restrict it significantly by avoiding the risk factors like tobacco smoking or tobacco chewing in the form of betel quid. And if you are drinking alcohol, then you can significantly reduce the amount or use it in moderation. Along with that, you can prevent getting oral cancer from HPV infection. Prolonged sun exposure can also lead to lip cancer. We can avoid this kind of risk factors. If it is hereditary, then I'm bound to get it. Fact is, few conditions run in the family, oral cancer is included. If someone in your family has it, you run a high risk of getting it. However, you're not bound to get it. Less exposure to risk factors can bring down your chances of getting oral cancer significantly. Regular screening is crucial for people with family history. That will paving way for early mouth cancer treatment. My oral cancer has gone now, so I don't have to worry anymore. But the fact is, once you have had oral cancer disease, you are automatically at a greater risk of developing another oral cancer or recurrence of the disease. So regular screening is very crucial and important for people who have got oral cancer which has been cured or which has been treated. This is advised to people who have got their treatment done for oral cancer. Regular visits every 6 months is required. If you notice any bleeding, any sore throat, any swallowing issues, or any white or red patch again, then assessment of that tissues or assessment of that disease is very much important in your cases. If you are noticing a weight loss, that is also crucial to get checkup done regularly. There are no methods of preventing oral cancer. The fact is, the most important step in preventing oral cancer: quit smoking or never start smoking, and avoid all tobacco products. Start eating fresh fruits and vegetables. Less exposure to sun, because more sun exposure can lead to lip cancer. And getting HPV vaccine, having safe sex can prevent you from getting HPV infection that can lead to conversion of oral cancer. With this, friends, I will conclude this topic. If you have any questions, you can comment on my comment box. I will try to reply on all the queries you have. Please share this valuable information with your family and friends. Please like and subscribe my channel so that more and more people can benefit from this channel. Thank you so much, friends. Take care. Bye bye.